Hello, welcome to a nasogastric tube insertion demonstration. Today I'm going to be going over how to insert a nasogastric tube, what to document, what to assess for, and everything that you're going to need to be successful for your checkoff. So let's start with what we would need to do before we come into the room. So before we get to this point at the bedside with the patient and all of our supplies, we would start out of the room and we would be checking the patient's chart to check for the orders. We would verify our orders. We would gather our supplies. Then we would enter the patient's room, set our supplies down, wash our hands of course, and then we're going to put on clean gloves. And then we can introduce ourselves and explain the procedure, verify the patient. Hello, I'm Chad. I'm going to be your nurse today, and I'm actually here to insert a nasogastric tube. Can you give me your name and date of birth, please? And I'm just going to verify that with your armband. All right, thank you very much. So I verified the patient. So what I'm going to be doing is inserting a nasogastric tube. Your doctor ordered that, and so we would explain why the doctor ordered that procedure. The patient could have a bowel obstruction, for example. So the stomach needs to rest, that needs to resolve, so we would suction the stomach contents out. So we would explain that to our patient. And then we're gonna raise the bed up to a working position because it's really too low for me right now. I don't wanna have to hunch over. The patient's already sitting up in the bed in nearly high Fowler's position, but that's where we need to go with our patient. So look, I'm just gonna sit you up pretty much all the way, okay? So when we insert the tube, that just makes it easier for you. So one thing we want to make note of is, as well, whenever we're done with this procedure, the patient cannot lay down. They can be as low as 45 degrees, but they cannot go lower than 45 degrees. So we have an irrigation tray with piston syringe. So we're going to use this specifically for our scenario to aspirate contents and check to make sure that it's actually in the stomach. That is right there. pH strips. We're going to use those stomach contents to measure the pH level. So we're going to use one of these strips. And also what we're going to do is to take a look at what color the pH strip turns when the fluid is placed on the strip. So we want it to be at 4 or below. We have a cup with a straw. So this is just to help facilitate swallowing. So when the tube is inserted, the patient has to swallow the tube. So this is going to help that. We're going to have tape, of course. We need to tape the patient's nose, for example, when we're done. We also are going to tape a spot on the tube itself to know how far to go. Tongue depressor, we're going to check the gag reflex. If we need to look in the back of the throat during the scenario, we can. Lubricant, so this is going to lubricate the tube to make it easier to go down and not cause trauma to the nose. This is the specific tube. So it's the Salem Sump nasogastric tube, and this is a 12 French. So that's appropriate for an adult. So let's go ahead and just set this down, and then we'll continue on with the supplies we need. Look, I'm just going to set this right here, okay? We're going to place this basin down, so there's a potential risk of vomiting. Most likely not, but it's possible if the patient gags or gets too upset. So we have all of our supplies out. So at this point, we need to measure the tube because we need to know how far to insert the tube. Okay. Salem Sump nasogastric tube. Let's talk about the tube first. So of course, this is the end that we will insert in the patient's nose. There are markings here. Those can be seen on x-ray. So you can tell from x-ray how far the tube is because you can see the numbers. This is a vent. So basically what this does is it prevents, when suctioning is used, it prevents the stomach lining from potentially being damaged by suctioning. So it keeps it from getting stuck to the lining basically. So we want to leave that vent open. Okay, this right here, of course this is the end of the tube. This is just the connector. We need to make sure we don't lose that. But if we're going to connect to suctioning, we have to have that connector. So I'm just going to place this end of the tube in my basin. And I'm going to start at the tip of the nose. And I'm going to go to the earlobe. And I'm going to go to the xiphoid process. All right, so it's about 44 centimeters. So I'm going to take a piece of tape and I'm going to wrap around that 44 millimeter section. So one thing that's important to do is to assess your patient. So we are going to need to assess we're going to need to assess what is the proper nair. So what is the proper side of the nose to go into? Whichever side the patient can breathe better into is the best option. So we would check for that. We could ask the patient to occlude one nostril and breathe out. We can check it ourselves if we need to. Okay, so we've measured. We want to ask about a history of any facial trauma, nasal surgeries, any of that. Have you ever had any injuries to your face anywhere near your nose before? Okay. Do you have a history of a deviated septum? All right, so if she answers no to all that, that's great. Another thing we want to do before we insert is check gag reflex. All right, can you just say ah, open up and say ah for me? So we're gonna push down the back of the tongue, the patient gag. All right, so what we can go ahead and do is lubricate the tube, and we could also get everything else ready. So we're just gonna open up the package along this perforation. And we're just gonna stick that end of the tube in our package. And of course, we're only lubricating a couple inches here, but as the tube gets inserted, it's gonna spread to the rest of the tube, the lubricant is. So it's lubricated and ready to go. We're gonna need a couple of pieces of tape. We want one piece of tape to temporarily secure to the cheek while we test stomach contents. And then lastly, we're gonna need one long piece of tape to secure to the nose. And how we're gonna do that is we are going to split down the middle with this piece of tape. Not all the way though. So think of it like you're trying to create a little pair of pants. And so this top part is gonna go on the nose and the bottom part is gonna wrap around the tube, one piece at a time. We've got our pH strip ready to go, peeled off and ready to go. So we're gonna go ahead and give our patient their water. So of course, if the patient couldn't hold it, then you could have an assistant or another nurse hold the cup for them and help them to drink. So we're gonna explain the procedure as we go. So we remove our tubing from the lubricant package. Okay, so it's time to insert the tube, okay? So I'm gonna insert it into your nose, and I need you to tilt your head back like that, okay? So for checkoffs, just tilt their head back like this. It makes it so the instructor understands you know that the head needs to be extended. So as the tube is initially inserted, the head is extended. When it passes the nasopharynx, the back of the throat, they generally will gag, and then you will give them a break for a second, and then they're gonna swallow, and they're gonna tilt their head forward as they swallow. They're gonna flex their head, and we're gonna say swallow. And as they swallow, we're gonna continuously insert the tube. All right, touch your head back for me. Take a deep breath, okay? We're gonna get through this. All right, so we start to insert. All right, you doing okay? All right, keep going, okay? Oh, I see that you gag. You all right? Okay, so what I want you to do now is tilt your head forward for me. Now take a sip of water, okay? So we're gonna say take a sip. Now, all right, when I tell you to swallow, swallow, okay? Take a sip and swallow. All right, swallow. Good job. Swallow. Great. Swallow. You're doing great. Swallow. Okay. Are you feeling okay? Okay, so I don't have to keep holding this like this. For right now, I'm just gonna pull this to the side and I'm gonna tape this to the side of their cheek. So that's not gonna fall out. So it's very possible if the patient has a full stomach that you would start to see stomach contents coming out. We're gonna remove our connector. We can just leave it in this container here for now. And we are going to connect our piston syringe. All right, and then we are going to aspirate. Now we don't need to aspirate all of their stomach contents just to check for pH. If we were going to do a feeding now, we actually would need to take out all stomach contents, measure how much, and then we reinsert the stomach contents. But for our sake, we're just gonna aspirate what we need at this moment to check for, check to make sure that it's in the right spot. Because for our scenario, we're just doing suctioning. So the doctor ordered suctioning. So we're gonna draw back and let's just, it's fairly arbitrary, but let's say 10 milliliters. So we've drawn back 10 milliliters of stomach contents. And then we'll just go ahead and put the connector back on. Let's leave this sitting upright because it might leak all over the bed if it's not sitting upright. You could even just leave it here potentially just to be safe. And that's really fine how it is right there. All right, so pH strip. All right, so we'll directly squirt those contents on the end of this pH strip and it will read immediately. So the color will change. All right, so we want to see what the color is. 4 or below, we can verify that we are in the stomach. So that's complete. We verified that we are in the stomach. So we're just gonna leave it as is. Let's go ahead and securely tape it to the nose. So this top part is gonna be on the bridge of the nose, like that. We can remove this piece of tape. And we're gonna take one piece first, and we're just gonna go all the way around with that piece. Just keep making circles around the tube itself. And some facilities have specific adhesives that may flip around and go up on the nose again. It just depends. But this is definitely a secure way that will work. All right, that is not going to fall out. We do need to either use a safety pin on the gown or place a piece of tape on the chest. Because we do not want this to fall out. All right, so I know y'all can't really see this, so I'm gonna pull this out. But there would be a tube that looks just like this, that goes from here and connects to this. There'd be a tube that would connect from here to there. It's hard for you to see probably from this angle. This is our vacuum. And so you would turn it on to the prescribed amount of suctioning. You would just turn this dial and that's it for the suctioning. So what's gonna happen? It's gonna start to suction. It's gonna fill up this canister and eventually we'll have to dispose of this. But we would see how much is coming from the patient's stomach in this scenario. So, remember we said patient can't lay down less than 45 degrees now, so we can put them down some if they would like. We have the call light in place. patient needs to be able to call the nurse at any time. All right, so let's leave him like that. We're going to document. So what we are going to document is everything that we did, and that's the case for every checkoff that we do. So let's think about what we've done so far. So when we entered the room, we of course gathered supplies, identified the patient, we assessed for any nasal trauma, facial trauma, nasal surgeries, and then we would state in our documentation whether or not we what our findings were. So if there is none, then we would say no surgeries noted, no facial surgeries noted, for example. No history of deviated septum. Explained procedure to patient. Checked patient's gag reflex with a tongue depressor. Inserted 12 French Salem sump nasogastric tube per physician order. Patient tolerated procedure well. Secured tube to patient's nose. Verified a pH of 4.0. Connected to suctioning as ordered. Patient tolerated procedure well. Placed bed in lowest position. We want to make sure that the patient is comfortable as can be before we leave the room. Put our bed all the way down to the lowest point. Remember, that's for every single skill. Every time you leave the patient's room, always put the bed down to the lowest position. Hope you learned something. Have a good day. Good luck.